Advances in medical technology happen all the time. One of the latest, a next-generation breast implant that provides women with peace of mind. Board-certified plastic surgeon Dr. Naveen Setty of Setty Plastics and Aesthetics is here to tell us about the ideal implant, along with ideal implant patient Shay Leach. And welcome to both of you. Nice to have you here.
Thank you.
So, Dr. Setty, what types of plastic surgery procedures do you specialize in, and what do you enjoy about your work?
Sure. So, as you said, I'm a board-certified plastic surgeon. So what that means is I'm trained to do lots of different procedures. What I really enjoy to do is breast and body contouring procedures. I find them very fulfilling. Really makes a significant transformation for my patients. And really the best thing about being a plastic surgeon is just that I get to make my patients happy. You know, it's
See
a
those
great
smiles.
job. Yep, exactly.
Okay, so what benefits does the ideal implant offer compared to previous options?
So previously, I have the implant sitting right here. We basically had two options. That's what was available for most women in the past. We had saline-filled implants and silicone gel-filled implants. Both have their advantages and disadvantages. Saline implants are filled with salt water, so if they ever did rupture, which is always a possibility with implants, the salt water would just leak out and be absorbed, no big deal. A woman can look in the mirror and tell something's wrong. But they don't feel very natural, and they tend to ripple, which can show through the skin, so some disadvantages with that.
Right.
With silicone gel implants, they're much softer. They feel more natural, feel more like regular breast tissue. But if they were ever to rupture, it's more difficult to detect. You can have what's called a silent rupture, where the gel will, when the gel ruptures, it's not going to leak out and immediately deflate, so a woman can't detect something is wrong. So actually, when the FDA reapproved these implants in 2006, they recommend you get an MRI every couple years, which puts a lot of burden on the patient.
Right.
So that's where the ideal implant came in, and it's really unique, very different from these other two implants. It's actually what we call a structured implant. It actually has internal structure where there's shells within the outer shell, which actually gives it its feel and makes it feel more natural, like a silicone implant, but it's filled with saline. So if it ever were to rupture, it would deflate, and a woman can tell.
Okay, so how does it compare to other implants when it comes then to complications, which is what you're concerned about?
Yes, correct. So, you know, all implants can have complications, but ideal implants have a lower rate of complications so far at about 8 years. Right now we have 8-year data. At 8 years, there's a lower rupture rate compared to silicone implants and a lower what's called capsular contracture rate. Both of those are reasons that implants can need to be removed or changed out. Capsular contracture is basically where scar tissue forms around the implant, and it can thicken and harden and be a reason implants have to be removed. So again, ideal implants have a lower rate.
So what about your patient satisfaction?
Yeah, so our patients have been really happy with them. They've loved them. You know, the interesting thing is when they come in for their follow-ups, I have to look at the chart to tell, did they get silicone or ideal, because I can't tell the difference. They both give a very natural look. So.
Okay, so Shay, why did you choose the ideal implant?
I chose the ideal implant because, for one, you don't have to worry about the silent rupture and the natural feel that it will give versus a saline. And it was just the better option, you know, health-wise, and I'm very active, so it was honestly the best option.
So what would you say about your overall experience and results?
Well, first of all, my experience just through Setty Plastics was amazing. I mean, I couldn't have asked for a better surgeon, staff, everything was amazing. My results were just as great. They ended up exactly how I wanted them to be. They feel natural, they look natural. Nobody could ever really even tell that I have, you know, had surgery done.
So what would you say to women who may be considering some type of breast augmentation?
I would say for sure, you know, do your research on the implants, know what you're putting in your body, and make sure you have a board-certified plastic surgeon.
Well, thank you both for being here.
All right,
interesting information. Setty Plastics and Aesthetics has locations in McKinney, Allen, and Dallas. Call 972-930-0333 for a no-obligation consultation on breast enhancement options or any other procedure. You can also log on to settyplastics.com.